If you are new to our page, just click on the like button or on the follow button to follow us and then get educated on Christian, psychological, health, and what social issues. We are all about making an impact, and then we have started already, so don't be left out. So today is Menstrual Hygiene Day. Woo! So I am celebrating all the strong women out there that go through this premenstrual syndrome every month, that goes through pain, sorrow, cries, being admitted into the hospital. It's not easy. I celebrate you. So today I want us to learn a bit about menstrual hygiene tips and mistakes that we do during our period. Okay, so most women grew up without being educated about these things, all because when you're on your period it's something sacred that was being done at home. But today no, we are going to cancel all that. So let's go on ahead. What is menstruation? Menstruation is just shedding away of the unfertilized egg, blood, uterine, and the what, and the lining tissue. So the blood that flows every month is what is called what, menstruation. So when we come to menstrual hygiene management, what is it all about? When we talk about menstrual hygiene management, it's all about cleaning oneself, trying to get absorbent products that will be able to absorb the blood, trying to get good water to wash yourself, and not only that, you get the required and having access to facilities to dispose of what your used menstrual management. That's all about it. So when we talk about period products and cloths and all that, but we never saw that. So I want to talk to us about poor hygiene habits. Poor hygiene habits is a very I don't want to say important, but it is important. Okay, what does it do? It always causes odor, and odors associated with menstruation. That is what poor hygiene does. This can be just as simple as changing your pads every day, or like every few hours or something like that. But some people don't do it, and that is poor what, hygiene habits. Anything you do that is unhygienic during your period, it is what is termed as what, poor hygiene what, habits. So let's go to some taboos, some myth, and then other things. And I was in the secondary school, they used to refer to menstruation as a car has knocked you down. I used to get so upset. I used to get so angry. Like, why would they say car has knocked me down? I'm just on my period. But that is because of how sacred people saw it to be. You cannot just tell somebody that I'm on my period. You have to say I'm on red. I'm this, all kind of words. That thing used to really irritate me. But what can I what can I do? But they were all myths and all those things. And what are some of them? You cannot cook, you're an unclean person, you need to purify yourself before someone touches you, you need to be segregated away from the community, and all those kinds of things. It wasn't really good those days, and even now some married women go through that in some religion, you know. I don't know what to say, but this is God gives to women. That shows you're fertile, or you know, you are capable of giving birth. And some people just think that at that very moment you're unclean, you need to be taken out of the house or the home, or whatever thing. Well, let's go on ahead to what importance of menstrual hygiene. Why is menstrual hygiene important? It's very important because if you practice poor menstrual hygiene, it causes what, reproductive tract infection. Poor menstrual hygiene is one of the major causes of what, RTIs and female morbidity. If you go through the records about, I'm a health personnel, I'm a public health promotion officer, or public health promotion educator. So I know all these things, and it's very common. Okay, women go through a lot of urinary tract infections and all that, just because of what, poor menstrual hygiene. They don't know about any what, knowledge. And I would want to use this opportunity to I would want to plead on behalf of uneducated women, or uneducated ladies who don't know much about menstrual hygiene. If you can, just try to buy one pad for somebody every month. Every you know, this person is vulnerable, this person doesn't have much and needs it. If you can help the person, I would be very happy that you were doing that. So the number one menstrual hygiene practice that you need to do is what, change regularly. Why am I saying this? Some people feel that, oh, there isn't much blood, there isn't much this, there's no need to change, let me just go on ahead and wear one part a day or two parts a day. No, but the reality is that you need to change your part every 4 to 6 hours. Yes, you don't need to change it because there is no blood or there is blood. Why am I saying it? Menstrual blood, when released from the body, attracts various organisms from our bodies, which multiply in the warmth of the blood. It causes irritations, rashes. When you're on your period, you have irritations, rashes, you have urinary tract infections. All these things is because you don't change your pad regularly. Try it. When you change your pad regularly, you will see that you are very comfortable. The place is airy. You don't go through any menstrual kind of infection. You're very safe. And why you need to change your pad is because it also prevents what? Odors and smell. Yes, some people, they have very bad odor coming out from that place when they are menstruating. It's because they fail to change their part every 4 to 6 hours. It's very important. Number two thing is that wash yourself properly. Why am I saying you should wash yourself properly? Washing your vagina regularly is extremely important because the organisms cling to your body after you have removed your sanitary pad, and we all know about this. Removing your pad can be so messy. It touches your hands, it touches your laps, and all those kind of places. And more to the point, some people do not wash themselves at the right way, or in the right way. Why am I saying this? They wash from their butt to their honeypot, let me say, to their vagina. So what am I saying? They carry the bacteria, they carry all the germs and infections from the butt to the honeypot. It's not supposed to be that. It's rather supposed to be the vice versa. Like you wash from your honeypot down to your what? To your anus or to your butt. That is what is supposed to be done, because at that moment when you're menstruating, you are very vulnerable to infections and all that. So at that very moment, you need to be hygienically strong. Like you need to be, you need to take that time of your month very important. If not, you're going to get infections every month. And number three is that don't use soaps or vaginal hygiene products. Why am I saying this? All these products you have, they are made of chemicals, they're made of pesticides and all those kind of things. I have for once never used any hygiene soap or any but anything to wash myself. No, the vagina cleanses itself. It made up. God is so wonderful. He makes it so way that it's a cleansing mechanism on its own. So you do not need to use any additional soap or whatever thing to wash it. You just need to use water, warm water or lukewarm water to wash it very well, and you'll be surprised that throughout your days you're going to be fine. You don't need anything. Bacteria wouldn't grow there because some of these products affects the normal pH, the normal flora of your honeypot, and at the end you cause so much trouble, you cause harm to yourself than good. Number five is discard the sanitary napkins properly. This is very important. I'm happy that Sakawa men or fraud boys have been able to teach women how to discard their napkins, their sanitary napkins properly. Why am I saying this? If you walk to the dustbin, if you walk to the someone's refuse dump, you'll be surprised the number of parts you would just see lying there. Why am I saying this? I'm saying this because there's this thing called scavengers. So we have the vultures, the bears, they are called scavengers. These animals pick these things up to the roof to go and eat or do whatever thing they want, and then it will rain. When it rains, the rain comes down and you collect this water again to drink. You can imagine the harm you're causing to yourself or to people around you. So what are you supposed to do? You're supposed to rub this thing up. I never knew there was one lady who used to throw things away. I thought it was banana peels or orange peels. I never knew that it was part that she would wrap it so nicely in the polythene, and then when she gets to the refuse dump, she throws it away. Some women, they remove their used parts and put them under the bed. They keep them there till they finish. Keep them there till they are done with their period. Sometimes they even forget to enter the room. It's so smelly. I have seen this actually before. Some people, you look under the bed, you see used parts there in their bags, in their wardrobes. Why would you put used parts there, for Christ's sake? It's not a good thing. Some wise women decide to flush this thing in the toilet or in the water closet. it is not a good idea either, because it clogs up the hole and water splashes out, and even the water that comes out is still contaminated because the bacteria in the blood has mixed with the water, and it's just so messy. And then you also need to wash your hands properly after you change every sanitary napkin. It's very, very important. And the next thing is that stick to one method of what sanitation. You have some people, they will double the pads to use. Please, my sister, or please, my lady or my woman, that is not a good thing. You are supposed to use one sanitation at a time. The reason why I don't want you to use the reason why I want you to stick to one method is because when you keep on using different methods, you think that, oh, the blood is not flowing well, so let me keep this pad. It interferes with your with you changing your pads every 4 to 6 hours. The combination of these two techniques, it absorbs blood, making it oblivious to the need to change your pad. And the frequent change, the accumulated blood invites bacteria. Without frequent change, the accumulated blood, it invites bacteria and causes infection. So it is advisable to use one sanitary at a time. These things will help you stay healthy and manage your menstrual period. It is very, very important. So let me quickly dash into the mistakes what women do when they're in their period, or when they're on their period. These are common mistakes that almost every woman has done some before. The number one mistake is what? Do not forget to rest or sleep. It is very, very important. I remember one time I was going to lecture a course, and I was like, oh, I'm trying to impress my students, like, oh, I can do it. But I knew very well that every month I had this menstrual cramps and all that. I was walking to the school. I didn't even get halfway of my journey, and I had to be taken. People had to carry me back to my to my house or to my room because the pain was unbearable. I couldn't talk. I was vomiting. It wasn't a good sight to behold, brethren or sisters. So what am I trying to say? If you're working, if you're a student, take a day off, take 2 days off. You need to rest and sleep properly. You need it. It is not a want, it is a need. You need it. So do well to get this. It will really help you. Number two thing is, don't let the cravings win. Number two, don't let the cravings win. I know I'm a lady. When I'm on my period, the white chocolate, I want it. The donut, the this, the that, the sobolo, and all those kind of snacks and junk. That is what I want when I'm usually on my period. But it is not advisable for you to take that, because you will need to exercise or work hard to lose all those calories that you have gained. It's not easy to lose those calories. So you're supposed to continue eating healthy, eating a balanced diet. That way it will even help you. It will even ease down your cramps. And let's not forget about drinking water. Some people, they don't want to drink water because it makes them bloat. It makes them, I don't know, they have so many reasons why they don't want to. But number one important thing that you need to drink water is because you need to stay hydrated. You are losing blood. You need to be hydrated. And even when you take in more water, you are able to ease down the swelling and the bloating, which comes with the hormonal fluctuations. It is very, very important for you to drink water. That's for the water. I will stress on it. Please drink a lot of water. And don't forget to buy your own pad. I don't know why women always forget that they will menstruate. It's like, oh well, like the message is like, I've come, and you're like, you need to prepare for it. No, you know that when you start menstruating, you never see this until menopause. Some women, they don't even want to invest into their menstrual hygiene products or period products. I remember in the university, there was this girl, she would beg pads all around, even in secondary schools. There was this lady, every month she's going around dormitory and begging for pad. It shouldn't be that way. It should not be. You should never beg for pad. Do you know what people do with their pads? You know what people say to them? And it's not just advisable. It's not hygienic. You don't know how that person has stored her pad, and you have gone for it. You are supposed to buy your own pads. Keep them safely in a hygienic place for you to use. Do not go around begging. Or some people even use toilet rolls or paper rolls because they run short of tampons or of sanitary pads, and you're forced to use paper towels. All those things causes problems, urinary tract infections, and reproductive tract infections. The next thing is that the next mistake ladies do is that they have sex during their period. Some people think that, oh, I'm safe when I'm on my period. No. A lot of people get pregnant when they do that, because if you have a short lifespan, like from 20 to 25 days, it's very short. So you ovulate earlier than somebody who has a 28 days or more. So if you think that you are safe, you are not safe, and you are more likely to get sexually transmitted diseases, HIV. You are more likely to get syphilis. You are more likely to get gonorrhea, because this thing, you are coming into contact with blood, just like that, direct contact with blood. And some women also suffer pelvic inflammatory disease as a consequence of the cervix being dilated, because when you're measuring, your cervix is what is dilated, and for that matter, you're exposed to all these things. So I would advise that well, I cannot tell you what to do as a married woman, because I know some married women do it and they are fine, they're okay, they are doing well, they don't care. But as coming from the health background, I would just advise to people who are not married and they engage in premarital sex to be cautious of these things during their time. As for the married, they can decide what they want to do. So the next thing is that don't avoid tracking your menstruation. Why am I saying this? We have seen a lot of people, in the bus, it comes, and they are soiled in the classroom, at lectures, in the market, in the school. It's very common. There are so many menstrual apps that you can download into your smartphone to track your cycle. You do not need to be a stranger to your own menstrual flow, or to your own period. No, you know that it will come. You need to track it. The second reason why you need to track it is because you need to know whether you have irregularities in your menstrual flow. Maybe you had it 28 days today, the next time you're having it in 25 days, in 21 days. You need to see a gynecologist, my sister, because these irregularities could mean a lot of things. Could mean cancer, yeah, like cervical cancer, could mean fibroid, could mean a lot of women associated kind of health issues. Okay, so it is important for you to track your cycle. It is very important. Don't say I didn't tell you. You need to track it so that you'll be aware that, oh, this day is this day is that, to get ready for it. If you need any treatment, you can go for it. The next thing is, don't wait to take medications until your cramps are bad. That was before. I used to wait like my first day, and then I take my drug. By then, it has pained me to the utmost height. So when I got to know, what I did was that I just take my drug. Okay, so right now there are a number of drugs, so many crumbs drugs that I know, but I do not want to just say it out there for everyone. If you're going through a serious, some people even have to be admitted into the hospital to be treated of this. So if you're going through serious menstrual cramps, you can DM me. I'll just give you some types of drugs to try. If it works for you, that is it. Okay, so the next thing is that don't use scented toilet paper, tampons, or pads. This can be irritating to your skin and might even cause a skin burn or symptoms like that. All those fragrance, they contain additives like alloy, pesticides, chemicals. They are not good for you. They are not hygienic. I will not recommend anybody to use any scented paper, tampons. Do you know what chemicals is made of it for you to use? Something you're going to use as a pad direct to your vagina and to your urethra. You should know what you are using. Okay, so I have said a lot. I'm running because of the time. I just wanted this to be short. So please do well to share this knowledge. Don't keep it alone. Don't be greedy. I wasn't greedy. That's why I came to share it with you. So I would be very pleased if you could share this to everyone. Bye.